Next file, House file for the calendar today is House File number 1712. The clerk will report the bill.
House File number 1712, number 3 on the calendar for the day, an act relating to health occupations, the first engrossment.
Recognize the author, Representative Pierson, to introduce his bill.
Thank you, Mr. Speaker and members. This is House File 1712. This is something we hear from our constituents a lot, is about the access to dental care, specifically in public program public program enrollees. This bill is a minor policy change that I, along with many stakeholders, believe will increase access to needed oral health care for some of Minnesota's most vulnerable patients. The bill will make updates and improvements to an existing law to better use a model that allows dental hygienists and dental assistants to collaboratively work with dentists to provide services in community settings such as schools, Head Start programs, long-term care facilities, and other community locations. Worked with a lot of stakeholders in this issue for actually quite a considerable amount of time. Doesn't sound like there's any opposition to this bill, and I ask for your green vote.
There are no amendments at the desk. The clerk will give the bill its third reading.
Third reading, House File number 1712.
Third reading. Discussion to the bill. Seeing no discussion, the clerk will take the roll on the bill. Clerk will close the roll. There being 131 ayes and 0 nays, the bill is passed and its title agreed to. Next bill on the calendar for the day is Senate File 341. Clerk will report the bill.
Senate File number 341, number 4 on the calendar for the day, an act relating to health, the first engrossment.
I recognize the author of the bill from Douglas, Representative Franson.
Thank you, members. Mr. Speaker, thank you. It's an exciting day on the House floor. This doesn't happen very often. Actually, it's never happened. This is my second bill, so that's pretty cool. Senate File 341, the bill simply broadens the type of investments that a public hospital is allowed to make to basically include securities. This puts a public hospital on an equal playing field with the non-profit hospitals. The bill has a couple of important protections in it, members. Any investments have to be made or have to be recommended by a registered investment advisor, must be invested according to the written investment policies and written investment procedures established by the governmental entity. This bill was originally brought to me by the Douglas County Hospital, which is the second largest public hospital in the state. 15 Minnesota hospitals have converted from public to nonprofit since 2004. There are only 30 remaining public hospitals, and many of them are not doing financially as well as similar nonprofit hospitals. Hopefully, hospitals will not be reliant on investment income to support operations, but this could make an enormous difference for building projects and paying off bond payments ahead of schedule. And now I'd like to yield to Representative Eklund, as he has a provision in the bill as well.
Recognize the Representative Eklund.
Thank you, Mr. Speaker. Members, in my provision in the bill just will simply allow ambulance districts that have levy authority to use their money towards training, so it doesn't go just to equipment and capital investment. Thank you, Mr. Speaker.
There are no amendments at the desk. Clerk will give the bill its third reading.
Third reading, Senate File number 341.
Third reading. Discussion to the bill. Member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker and members. Well, I have some questions about this bill if Representative Franson would yield.
She will yield. Representative Liebling.
Thank you, Mr. Speaker. Representative Franson, I've given this bill a lot of scrutiny, and there are a lot of things I don't quite understand about it. First of all, could you just tell us what committees did this bill go to? I'm pretty sure it went to Health and Human Services Reform, but I don't think it went to either Civil Law or Commerce or anywhere that the issue about scrutinizing investments could have been discussed. Am I correct on that?
Representative Franson.
Thank you, Mr. Speaker. Representative Liebling, no other committee recommended to hear the bill.
Representative Liebling.
Thank you, Mr. Speaker. Well, Representative Franson, you gave a brief introduction, and I was listening very carefully, and you said that the difference would be that the public hospital that would, or I guess public hospitals, because this would affect all the public hospitals, would be able to invest in securities, and that is the difference here. But I took a look at the section of law that you are exempting them from, which is 118A. And in 118A, it has a sort of an exemption from liability for officials. It says neither such official, meaning the ones that are investing under the current law, under 118A, that official nor government entity nor any other official responsible for the custody of funds shall be personally liable for any loss sustained from the deposit or investment of funds in accordance with these provisions. So if the entity right now is investing its funds as it is permitted to do under 118A, there is some liability protection for the officials. Under your bill, is there any liability protection for the officials since they're no longer under the protection of this statute?
Are you asking the representative to yield?
I am, Mr. Speaker.
She will yield.
Can you repeat the question?
Representative Liebling.
Thank you, Mr. Speaker. Well, Representative Franson, under this, the meat of your bill is that it exempts public hospitals from Chapter 118A. Do you want to listen to Representative Hoppe, or would you like me to repeat the question? Okay. Let me repeat the question for you, and then if you like a moment, you can confer with Representative Hoppe. So the meat of your bill is to exempt these hospitals from 118A. That's what I'm understanding this to be. And 118A gives some liability protection to the officials who are doing the investing. And my question to you is, what happens under your bill when they're no longer under 118A? Do they have personal liability for making bad investment decisions?
Representative Franson.
Thank you, Mr. Speaker and Representative Liebling. First off, I'd like to address the fact of you accusing me of conferring with Representative Hoppe. I have every right to look behind me and gaze at my coworkers without being assumed that I'm asking him for how to answer this question. So thank you. Also, hospitals that are not government owned have the ability to invest cash in options that are not restricted by Statute 1118.
Representative Liebling.
Thank you, Mr. Speaker. Well, you didn't answer the question at all, Representative Franson. And Representative Franson, it's not an accusation. We always, it's quite often that we confer with the people around us. And I think Representative Hoppe, since he's the chair of the Commerce Committee, is probably quite knowledgeable on this. It's really too bad the bill didn't go to his committee. But I didn't mean anything pejorative by the fact that you appeared to be asking him a question. I think that would be just fine, just like right now you're getting some advice from staff. There's no problem with that either. But, you didn't answer my question. The question was about specifically 118A gives some liability protection right now to the officials who are running that hospital that you are trying to help here have some liability protection under current law. You're exempting them from that statute. Will they still have the liability protection? That is my question.
Representative Franson.
Thank you, Mr. Speaker. Representative Liebling, it is my understanding that yes, they would still have that liability protection.
Representative Liebling.
If she would continue to yield, Mr. Speaker.
She will yield.
Thank you, Mr. Speaker. Well, Representative Franson, could you tell me where, just give me a little bit more explanation of where you see that, or, why you say that?
Representative Franson.
All right, so thank you, Mr. Speaker. Representative Liebling, on House File 559, I'm looking at. Which I don't have. Let's see, I have in my bill, and it'll be in the bill that you currently have. So I'm not sure what line it's on, though. Notwithstanding any limitation in Chapter 118A, investment hospitals, funds, and any security which has been recommended by an investment advisor registered under the Federal Investment Advisors Act of 1940, United States Code, Title 15, Sections 80B-1 to 80B-21, or by a bank or trust company exercising its trust powers. Funds invested under this clause must be invested according to written investment policies and written investment procedures established by the governmental entity.
Representative Liebling.
Well, thank you, Mr. Speaker. Well, Representative Franson, thank you for reading the bill language. That didn't answer the question at all. So I guess let me try another, I have some other questions, if I may, Mr. Speaker, if she would yield.
She will yield. Representative Liebling.
Thank you, Mr. Speaker. So Representative Franson, I mean, this may be, it may be that the bill is okay. I don't know. It gives me a little concern because from what I'm understanding that's going on here, the Chapter 118A, which is limits investment authority, applies not just to hospitals, but it also applies to government entities, which means a county, a city, a town, a school district, hospital district, which is what we're dealing with here, public authority, public corporation, public commission, special district, or any other political subdivision. So all of those government entities are under 118A, which limits their investment authority a little bit. And I don't know enough about the history of this, but there must have been a good reason why the legislature put all of these entities under this little bit of restriction. And I think it might be because these are taxpayer dollars that are being invested. So there's always a balance to be struck, I think, when you're talking about investment, when any of us invest our personal funds. We try to strike a balance between returns and safety, and every one of us has probably a different tolerance for how much risk we'll take in order to make greater returns, and there's always a trade-off there. And obviously, that's something about this statute that we're exempting these hospitals from. There was a decision made that government entities should be a little more risk-averse, because I would assume it's because we're dealing with taxpayer dollars. And, I don't think it's very hard to find some kind of an investment advisor, a registered investment advisor, to advise you to take some pretty risky securities. I mean, we had in 2008, the whole economy pretty much crashed because people were investing in some pretty risky stuff. And there were a lot of investment advisors, and I'm sure a lot of them were probably registered under the Federal Investment Advisors Act, and people still invested in some pretty risky stuff, and they lost money. So I do have some concern about this bill and why we're letting hospitals who are, after all, using taxpayer money. They are levying taxpayers to provide money for the hospital, and this bill says you can just go out and invest as long as you have a written policy. Well, under the current law, you still have to have a written policy. That's already in 118A. So there's no more protection here. So I guess I'd like to ask you, Representative Franson, why you think that it would be okay for hospitals to buy riskier investments than counties, cities, towns, school districts, public authorities, public corporations, public commissions, public special districts, or other political subdivisions. Why do you think it's okay for them to have more risk in their investments where they might possibly lose the taxpayer money in that investment?
Representative Franson.
Thank you, Mr. Speaker and members. Every hospital, public or private, receives reimbursement through taxpayer dollars. And so my bill is simply to bring it on pair with the even playing field with the nonprofit hospitals. So my hospital came to me and the law is ambiguous, and so they wanted a more clear definition, which is why this bill was brought forward. And the Hospital Association is on board. We have protections written into the bill that any investments have to be recommended by a registered investment advisor, must be invested according to the written investment policies and written investment procedures established by the government entity. I wouldn't do anything to the taxpayers that would cause risky things to happen, bad scenarios to happen, but I am just asking for a level playing field.
Representative Liebling.
Thank you, Mr. Speaker. Well, I don't know if it would be worth asking you to yield again, Representative Franson, but you now added something new that I'm really curious about, and that you said that your hospital thought there was an ambiguity in the current law, and I'd really like to know. I'm not going to ask you to yield, but if you speak again maybe at the end, well, maybe I will ask her to yield, Mr. Speaker, if she would yield again, because I'd like to know what the ambiguity is. Would she yield?
She will yield. Representative Liebling.
Thank you, Mr. Speaker. And you know, Representative Franson, I'm not against you helping your hospital at all. I just really do want to make sure that the taxpayer is protected, because I really seriously don't understand why they need this. So you mentioned that they're concerned about an ambiguity here. Could you explain what is the ambiguity that they want to avoid? And while you're at that, you know, you're talking about a level playing field between a public hospital that uses tax dollars, that can levy taxpayer dollars, and a nonprofit that earns taxpayer dollars by providing services. So why do those two need to be on a level playing field? I would think public hospitals would be on the level playing field with these other public entities like they are under current law.
Representative Franson.
Thank you, Mr. Speaker and members. Representative Liebling, we did hear this in committee. Maybe you missed that committee that day. That is a tragedy. Section 144.581 authorizes public hospitals to own shares of stock in business corporations. This language is vague with respect to the types of entities where public hospitals may invest. And this is coming from the Minnesota Hospitals Association. I'm reading this off of their form here from their attorneys. So the constraints of 118A and the ambiguity of 144.581 with hospital authorities is the reason why this bill is here before us.
Representative Liebling.
Well, thank you, Mr. Speaker. All right, well, thank you. I won't, drag out the agony too much longer here, but I do have some concern about this. And, it was heard in Health and Human Services Reform. I might have missed that day, but I don't think that this was discussed in any depth. I'm not sure if I was there, probably not. But I don't think there was a real discussion about what this is and what it means. And I really want members to pay attention to this because it may be fine. I'm certainly not saying that your people who run your hospital aren't capable of choosing safe investments. But if the idea is that they want to earn more money in their investments, what they're doing is doing that by taking on more risk. And we are exempting them from a statute that covers all these other entities. And I think it's really important to pay attention because this is taxpayer money. They are levying the taxpayers for the purpose of having a hospital to benefit the community, and then you're allowing them to take on riskier investments. And boy, oh boy, we all have a stake in making sure our hospitals stay solvent. I know it's sometimes very hard for them to stay afloat. I can understand their need to do this or their desire to do it, but I do have a lot of concern about it, and I hope that maybe some of you who have more expertise in this particular area will pay some attention to this because I think it's an important policy issue for us as guardians of the taxpayer dollar. Thank you.
Member from Rice, Representative Bly.
Thank you, Speaker. I just wanted to offer that Northfield has a municipal hospital, and I did call the administrator and asked him, was this something that he was interested in, or that was this something that they wanted? And he indicated yes, that it was something that his hospital and other hospitals were pursuing. I did ask him the question about the liability and also about risk, potential risk. His answer was that yes, there could be some risk, but their assessment was that the amount of return on the investment would overcome what risks there might be, and so he felt it was a positive venture. I hope that's the case. I do think the questions are important to ask, and my sense is that this is something that the public hospitals do want.
Member from Ramsey, Representative Pinto.
Thank you, Mr. Speaker. Members, I want to get back to the first point raised by Representative Liebling, because actually, as I've been thinking about this during the debate, I'm getting increasingly concerned, so just bear with me for a second. So Chapter 118A covers deposit investment of local public funds. That's the general chapter that applies. And Chapter 118A contains a limitation of liability for local officials that are stewards of these funds. It says that they will not be personally liable for losses sustained from the deposit investment of the funds. Now, the bill, the provision that's been put in here allows funds to be invested and has a number of, provisions in it, but it says that all this is notwithstanding any limitation in Chapter 118A. I listened carefully to the interaction between Representative Liebling and Representative Franson, the bill's author, and I guess I don't see how the protection of personal liability would apply once this bill passes. So I'll make sure we're very clear that the Douglas County officials that serve on the hospital board, and maybe I'm missing something, I would love to have somebody point out to me where there's language that would apply, but this protection of personal liability, they can be sued in their personal capacity, does not apply. This is notwithstanding any limitation in Chapter 118A. Now that's problematic obviously from a couple of perspectives. One is having our local officials be held personally liable. Another problem is trying to have people serve in these offices when they can be held personally liable, their own pocketbook and their own bank account. Now again, maybe I'm missing something. I listened carefully to the interaction. I know Representative Franson said that the protection would apply, but I just don't see how it would. So if somebody can point to a case, to a provision of statute, because otherwise line 2.13 of the bill says quite clearly, notwithstanding any limitation in Chapter 118A, I'm thinking anybody who wants to sue with some kind of disappointment regarding investment returns is going to realize there is no limitation on suing these people in their personal capacity. They can do that. I think that's a really big concern. I think the bill may need some more work to address that.
The member from Washington, Representative Dean M.
Thank you, Mr. Speaker and members. Well, Representative Franson, I thought your earlier bill might cause a little bit more of a disturbance than this one, but I guess we want to just be here a little bit longer today. Members, this is really not a controversial bill. This just deals with our public and nonprofit hospitals and allows our public hospitals to be able to have some of the benefits of nonprofit hospitals and their investments. Members, if you have a small hospital, public hospital in your area, please pay attention to this, because if you call the administrator and ask them how they're doing right now, they're probably going to tell you that they're not doing very well. And if we're looking at increasing the number of people on public programs that reimburse at a very low level, you're hitting them from both sides. If you're saying that you can't keep the doors open because you can't allow yourself a little bit more protection, and at the same time we're going to be adding more and more people onto public programs that reimburse at 50% of private health insurance rates, you're really hurting them. We only got a couple dozen, I think less than 2 dozen public hospitals left. They've been converting over the last several years. So members, if you care about Greater Minnesota, if you care about small hospitals, Representative Franson is doing something to help out here. It was brought to us by Douglas County Hospital. I think it's a good idea. Support our public hospitals. Support Mary Franson's bill.
Member from Ramsey, Representative Pinto.
Thank you, Mr. Speaker. I'll just say, if members, if anybody has a specific reason to believe that that personal liability protection would continue to apply after the bill, if you can point to some language, please do. Otherwise, when you talk to the administrator, you might want to point out that members of the board will be personally exposed to liability. And again, this may be a good thing in general. Chair Dean, if it said, notwithstanding any limitation in Chapter 118, except for the protection in 118A.02, that would be great, but it does not say that, and so it seems like a pretty risky move just on that particular point alone. Thank you, Mr. Speaker.
Further discussion? Seeing none, the clerk will take the roll on the bill. Clerk will close the roll. There being 120 ayes and 11 nays, the bill is passed and its title agreed to. Next bill on the calendar for the day is Senate File 562.
Senate File number 562, number 5 on the calendar for the day, an act relating to human services, the first engrossment.
Call upon the author of the bill, Representative Peterson, to explain your bill.
Thank you, Mr. Speaker. The bill you have before you is the Early Intensive Developmental and Behavioral Intervention, so EIDBI. It is a medical assistance program for individuals with autism and other related conditions. It is a product of collaboration between stakeholders, providers, and the Department of Human Services. It is unique because it allows for different appropriate treatment options that is determined after proper individual assessment. It modifies eligibility and clarifies criteria to conform with federal standards. It defines basic recipient rights and allows flexibility to cover new evidence-based therapies as we learn more about autism. Most importantly, it creates a process for granting exceptions to provider standards and enrollment procedures while we have a provider shortage. I want to thank the providers and the families and the other stakeholders who have engaged in this creation of this legislation. I also want to thank the bipartisan co-authors to this bill, and I ask for your support and I'm happy to answer any questions. Thank you.
There are no amendments at the desk. The clerk will give the bill its third reading.
Third reading, Senate File number 562.
Third reading. Discussion to the bill. Discussion to the bill. Seeing none, the clerk will take the roll on the bill. Clerk will close the roll. There being 131 ayes and 0 nays, the bill is passed and its title agreed to. Announcements by the Speaker.
Announcement by the Speaker. A message from the Senate has been received requesting concurrence by the House to amendments adopted by the Senate to the following House files. House File number 400 and House File number 792.
Motions and resolutions. There are copies of the non-controversial motions at the House desk and online. If there are no objections, we will take action on these motions first. Hearing no objection, the motions prevail. Announcements. Majority Leader Pepin.
Thank you, Mr. Speaker. I move that when the House adjourns today, it adjourns until 10 a.m. Thursday, April 27, 2017.
Representative Pepin moves that when the House does adjourn today, it adjourns until 10 a.m. Thursday, April 27, 2017. Representative Metsa.
Thank you, Mr. Speaker. And just a friendly reminder tomorrow night to come join us at the Ranger Party at Mancini's. Thank you.
All those in favor say aye. All opposed, no. Motion prevails. Majority Leader Pepin.
I move that the House do now adjourn.
Representative Pepin moves that the House do now adjourn. All those in favor say aye. All opposed, nay. Motion prevails and the House stands adjourned until 10 a.m. Thursday, April 27, 2017.